Question 36. The nurse is caring for a client with congestive heart failure. On assessment, the nurse notes that the client is dyspneic and that crackles are audible on auscultation. The nurse suspects excess fluid volume. What additional signs would the nurse expect to note in this client if excess fluid volume is present? A. Weight loss. B. Flat neck and hand veins. C. An increase in blood pressure. D. A decreased central venous pressure, CVP. Correct answer. C. A fluid volume excess is also known as overhydration or fluid overload and occurs when fluid intake or fluid retention exceeds the fluid needs of the body. Assessment findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, elevated blood pressure, bounding pulse, elevated CVP, weight gain, edema, neck and hand vein distension, altered level of consciousness, and decreased hematocrit. Options 1, 2, and 4 identify signs noted in fluid volume deficit. Question 37. A nurse is preparing to care for a client with a potassium deficit. The nurse reviews the client's record and determines that the client was at risk for developing the potassium deficit because the client A. Sustained tissue damage. B. Requires nasogastric suction. C. Has a history of Addison's disease. D. Is taking a potassium-sparing diuretic. Correct answer. B. The normal serum potassium level is 3.5 milliequivalent per liter to 5.1 milliequivalent per liter. A potassium deficit is known as hypokalemia. Potassium-rich gastrointestinal fluids are lost through gastrointestinal suction, placing the client at risk for hypokalemia. The client with tissue damage or Addison's disease and the client taking a potassium-sparing diuretic are at risk for hyperkalemia. Question 38. A nurse reviews a client's electrolyte laboratory report and notes that the potassium level is 3.2 milliequivalents per liter. Which of the following would the nurse note on the electrocardiogram as a result of the laboratory value? A. U waves. B. Absent P waves. C. Elevated T waves. D. Elevated ST segment. Correct answer. A. A serum potassium level lower than 3.5 milliequivalent per liter indicates hypokalemia. Potassium deficit is a common electrolyte imbalance and is potentially life-threatening. Electrocardiographic changes include inverted T waves, ST segment depression, and prominent U waves. Absent P waves are not a characteristic of hypokalemia but may be noted in a client with atrial fibrillation. Question 39. A nursing student needs to administer potassium chloride intravenously, as prescribed to a client with hypokalemia. The nursing instructor determines that the student is unprepared for this procedure if the student states that, which of the following is part of the plan for preparation and administration of the potassium? A. Obtaining a controlled intravenous, IV, infusion pump. B. Monitoring urine output during administration. C. Preparing the medication for bolus administration. D. Diluting the medication in appropriate amount of normal saline. Correct answer. C. Potassium chloride administered intravenously must always be diluted in IV fluid and infused via an infusion pump or controller. Potassium chloride is never given by bolus, IV push. Giving potassium chloride by IV push can result in cardiac arrest. Dilution in normal saline is recommended, and dextrose solution is avoided because this type of solution increases intracellular potassium shifting. The IV bag containing the potassium chloride is always gently agitated before hanging. The IV site is monitored closely because potassium chloride is irritating to the veins and there is risk of phlebitis. The nurse monitors urinary output during administration and contacts the physician if the urinary output is less than 30 ml per hour. Question 40. A nurse caring for a group of clients reviews the electrolyte laboratory results and notes a potassium level of 5.5 milliequivalent per liter on one client's laboratory report. The nurse understands that which client is at highest risk for the development of a potassium value at this level? A. The client with colitis. B. The client with Cushing's syndrome. C. The client who has been overusing laxatives. D. The client who has sustained a traumatic burn. Correct answer. D. A serum potassium level higher than 5.1 milliequivalent per liter indicates hyperkalemia. Clients who experience cellular shifting of potassium in the early stages of massive cell destruction, such as with trauma, burns, sepsis, or metabolic or respiratory acidosis, are at risk for hyperkalemia. The client with Cushing's syndrome or colitis and the client who has been overusing laxatives are at risk for hypokalemia. Question 41. A nurse is reviewing laboratory results and notes that a client's serum sodium level is 150 milliequivalent per liter. The nurse reports the serum sodium level to the physician, and the physician prescribes dietary instructions based on the sodium level. Which food item does the nurse instruct the client to avoid? A. Peas. B. Nuts. C. Cauliflower. D. Processed oat cereals. Correct answer. D. The normal serum sodium level is 135 to 145 milliequivalent per liter. A serum sodium level of 150 milliequivalent per liter indicates hyponatremia. Based on this finding, the nurse would instruct the client to avoid foods high in sodium. Nuts, cauliflower, and peas are good food sources of phosphorus. Processed foods are high in sodium content. Question 42. A nurse is assessing a client with a suspected diagnosis of hypocalcemia. Which of the following clinical manifestations would the nurse expect to note in the client? A. Twitching. B. Hypoactive bowel sounds. C. Negative trousseau sign. D. Hypoactive deep tendon reflexes. Correct answer. A. The normal serum calcium level is 8.6 to 10 mg per deciliter. A serum calcium level lower than 8.6 mg per deciliter indicates hypocalcemia. Signs of hypocalcemia include paresthesias followed by numbness, hyperactive deep tendon reflexes, and a positive trousseau or Kvostex sign. Additional signs of hypocalcemia include increased neuromuscular excitability, muscle cramps, twitching, tetany, seizures, irritability, and anxiety. Gastrointestinal symptoms include increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. Question 43. A nurse caring for a client with hypocalcemia would expect to note which of the following changes on the electrocardiogram? A. Widened T wave. B. Prominent U wave. C. Prolonged QT interval. D. Shortened ST segment. Correct answer. C. The normal serum calcium level is 8.6 to 10 mg per deciliter. A serum calcium level lower than 8.6 mg/dl indicates hypocalcemia. Electrocardiographic changes that occur in a client with hypocalcemia include a prolonged ST or QT interval. A shortened ST segment and a widened T wave occur with hypercalcemia. Prominent U waves occur with hypokalemia. Question 44. A nurse reviews the electrolyte results of an assigned client, and notes that the potassium level is 5.4 milliequivalent per liter. Which of the following would the nurse expect to note on the electrocardiogram, as a result of the laboratory value? EUE. ST depression. B. Inverted T wave. C. Prominent U wave. D. Tall peaked T waves. Correct answer. D. A serum potassium level greater than 5.1 milliequivalent per liter indicates hyperkalemia. Electrocardiographic changes associated with hyperkalemia include flat P waves, prolonged PR intervals, widened QRS complexes, and tall peaked T waves. Question 45. A nurse caring for a group of clients reviews the electrolyte laboratory results, and notes a sodium level of 130 milliequivalent per liter on one client's laboratory report. The nurse understands that, which client is at highest risk for the development of a sodium value at this level? A. The client with Cushing's syndrome. B. The client who is taking diuretics. C. The client with hyperaldosteronism. D. The client who is taking corticosteroids. Correct answer. B. Hyponatremia is evidenced by a serum sodium level less than 135 milliequivalent per liter. Hyponatremia can occur in the client taking diuretics, the client taking corticosteroids, and the client with Cushing's syndrome or hyperaldosteronism are at risk for hypernatremia. Question 46. A nurse is caring for a client with acute congestive heart failure, who is receiving high doses of a diuretic. On assessment, the nurse notes that the client has flat neck veins, generalized muscle weakness, and diminished deep tendon reflexes. The nurse suspects hyponatremia. What additional signs would the nurse expect to note in a client with hyponatremia? A. Extreme thirst. B. Decreased urinary output. C. Hyperactive bowel sounds. D. Increased specific gravity of the urine. Correct answer. C. Hyponatremia is evidenced by a serum sodium level lower than 135 milliequivalent liter. Hyperactive bowel sounds indicate hyponatremia. Options 1, 2, and 4 are signs of hypernatremia. In hyponatremia, increased urinary output and decreased specific gravity of the urine would be noted. Question 47. A nurse reviews a client's laboratory report, and notes that the client's serum phosphorus level is 2 mg per deciliter. Which condition most likely caused this serum phosphorus level? A. Alcoholism. B. Renal insufficiency. C. Hypoparathyroidism. D. Tumor lysis syndrome. Correct answer. A. The normal serum phosphorus level is 2.7 to 4.5 mg per deciliter. The client is experiencing hypophosphatemia. Causative factors relate to malnutrition or starvation and the use of aluminum hydroxide-based or magnesium-based antacids. Malnutrition is associated with alcoholism. Renal insufficiency, hypoparathyroidism, and tumor lysis syndrome are causative factors of hyperphosphatemia. Question 48. A nurse is reading a physician's progress notes in the client's record, and reads that the physician has documented insensible fluid loss of approximately 800 ml daily. The nurse interprets that this type of fluid loss can occur through A. the skin, B. urinary output, C. wound drainage, D. the gastrointestinal tract. Correct answer. A. Sensible losses are those of which the person is aware, such as through wound drainage, gastrointestinal tract losses, and urination. Insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. Question 49. A nurse is assigned to care for a group of clients. On review of the client's medical records, the nurse determines that which client is at risk for a fluid volume deficit. A. A client with a colostomy. B. A client with congestive heart failure. C. A client on long-term corticosteroid therapy. D. A client receiving frequent wound irrigations. Correct answer. A. A fluid volume deficit occurs when the fluid intake is not sufficient to meet the fluid needs of the body. Causes of a fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, and the presence of an ileostomy or colostomy. A client with congestive heart failure or on long-term corticosteroid therapy, or a client receiving frequent wound irrigations, is at risk for fluid volume excess. Question 50. A nurse caring for a client who has been receiving IV diuretics suspects that the client is experiencing a fluid volume deficit. Which assessment finding would the nurse note in a client with this condition? A. Lung congestion. B. Decreased hematocrit. C. Increased blood pressure. D. Decreased central venous pressure, CVP. Correct answer. D. A fluid volume deficit occurs when the fluid intake is not sufficient to meet the fluid needs of the body. Assessment findings in a client with a fluid volume deficit include increased respirations and heart rate, decreased CVP, weight loss, poor skin turgor, dry mucous membranes, decreased urine volume, increased specific gravity of the urine, increased hematocrit, and altered level of consciousness. The normal CVP is between 4 and 11 cm H2O. A client with dehydration, fluid volume deficit, has a low CVP. The assessment findings in options 1, 2, and 3 are seen in a client with fluid volume excess. Question 51. A nurse is assigned to care for a group of clients. On review of the client's medical records, the nurse determines that which client is at risk for fluid volume excess? A. The client taking diuretics. B. The client with renal failure. C. The client with an ileostomy. D. The client who requires gastrointestinal suctioning. Correct answer. B. A fluid volume excess is also known as overhydration or fluid overload and occurs when fluid intake or fluid retention exceeds the fluid needs of the body. The causes of fluid volume excess include decreased kidney function, congestive heart failure, use of hypotonic fluids to replace isotonic fluid losses, excessive irrigation of wounds and body cavities, and excessive ingestion of sodium. The client taking diuretics, the client with an ileostomy, and the client who requires gastrointestinal suctioning are at risk for fluid volume deficit. Question 52. The nurse provides instructions to a client with a low potassium level about the foods that are high in potassium, and tells the client to consume which foods? Select all that apply. 1. Peas. 2. Raisins. 3. Potatoes. 4. Cauliflower. 5. Cantaloupe. 6. Strawberries. Correct answer. 2, 3, 5, and 6. The normal potassium level is 3.5 to 5.1 milliequivalent per liter. Common food sources of potassium include avocado, bananas, cantaloupe, carrots, fish, mushrooms, oranges, potatoes, pork, beef, veal, raisins, spinach, strawberries, and tomatoes. Peas and cauliflower are high in magnesium.